Looking at the coronavirus vaccine rollout in Australia, the Pfizer jab has been approved, as we know, for use. The Therapeutic Goods Administration giving it the green light and reassuring Australians that it is safe for use. But unknowns do remain, particularly when it comes for the possible use for pregnant women and the elderly. Some experts are calling for more concrete information. Next hour, we'll be dispelling some of those myths. We'll be speaking with the President of the Australian Medical Association. There are other pressing concerns looming. There's a supply brawl brewing in Europe, which could threaten our supply here in Australia. Eliza Edwards begins our coverage.
A three-word pitch to protect Australians against the pandemic.
Safe, effective and free COVID-19 vaccines.
The public information push hitting TV screens, airwaves and social media from today, just weeks before the first Australians are vaccinated.
Going to those most in need of protection first.
The advertisements feature some of Australia's top health experts becoming household names in 2020.
We only will approve vaccines when we have enough evidence that they work and that they're safe.
The TGA this week determining the Pfizer vaccine is ready to be rolled out from next month.
Right now, we're concentrating on using the Pfizer vaccine for the most vulnerable in our populations.
The first phase of the rollout covers aged and disability care staff and residents and some frontline workers, followed by those aged over 70, Indigenous Australians and people with underlying health conditions. Around 7 million Australians fitting into these categories, most said to receive the Pfizer jab. The rest of the population expected to be vaccinated with AstraZeneca, pending TGA approval.
They're still going through the data for the AstraZeneca, and in time, when they've got full confidence, then they will provide us the advice about how and when we should work with the AstraZeneca vaccine.
The advice from the government is there shouldn't be any further impact on vaccine supplies arriving in Australia, despite the European Union threatening to block exports as it scrambles to secure enough doses of Pfizer and AstraZeneca.
Based on what we know today, that is not expected to change the arrival dates for those vaccines.
With supply shortages, the Prime Minister on Monday flagged a 2-week delay to the arrival of Pfizer, pushing it back to late February. Fewer concerns, though, about AstraZeneca, which can be manufactured on home soil.
We'll have 50 million doses available to us, made here in Victoria and Broadmeadows, which is a great security for us into the future.
Locking in the necessary supplies in the hope Australians do their bit and get vaccinated.
Which will give us the protection to go about our everyday lives.
Eliza Edwards, Sky News, Canberra.
Carefully by independent clinical experts.